What if you could carry your medical records around with you all the time just in case of an emergency? You can. We'll show you how easy it is. Well, there's much more ahead on this Tuesday morning. It's really no bigger than a credit card, but it has vital information on it that could save your life in a pinch. Find out how it is, or what it is and how it works. It's next on Live at 9. And welcome back to News Channel 3 Live at 9. Think about how ultra convenient it would be to have your medical records on you all the time in case of an emergency, no matter where you are.
It would be great. Now you can, and without carrying around a folder stuffed with x-rays and tests and doctor's notes. It's called MyRECORD, and the Memphis Heart Clinic is one of just a few places in the country to offer it to patients. You got it right there. Look how small it is. It's as small as a credit card. You could literally carry this in your wallet, and in fact, that's what the Memphis Heart Clinic advises you do. Dr. Joe Samaha is with the Heart Clinic, and Alan Hoxma is with him as well, one of the creators of MyRECORD. Such a brilliant idea. It's one of those that you go, why didn't I think of that? You were pointing out, Alan, a moment ago that medical mistakes are actually one of the leading causes of death.
Yeah. Because
people often don't have their information with them.
That's correct. Medical errors are a leading cause of death. And at the Memphis Heart Clinic a number of years ago, we made an investment to digitize our entire office. So it was paperless, and what that enabled us to do is to now push the medical record out to the patient. The patient is the only constant in the healthcare equation. People travel, people may have a heart attack in the middle of the night, and we wanted to provide the highest level of care we could. And that's putting their medical record right into their wallet.
Wow.
Incredible.
That is incredible. Joseph, what are some of the patients saying to you who have already taken advantage of this?
This gives our patients some comfort in their knowing that their medical record is available wherever they go, if they travel around the country or out of the country. Also, even within Memphis, if something happens in the middle of the night and they're taken to a hospital that they don't normally visit, then
this doctor has never seen them before.
Then this record is immediately available. It's in a format that can run on any Mac or PC, so and it automatically loads. So just putting it in the computer, it shows the data immediately.
Now, what kind of data are we talking about? How in depth does it go?
This has the patient's medical diagnoses, their demographic information, a list of all their medications and dosages, and then any procedures that they may have had, like a heart surgery or bypass surgery, a heart catheterization.
Wow, it sounds like even in not an emergency case, but in any case, it would save an awful lot of time for the patient.
It also has the patient's most recent electrocardiogram, so if they present to an emergency room with chest pain, they'll have a comparison document to look at.
Obviously, this is for a lot of different types of patients, but is it more specifically for one category more so than any other, or who would be one of the main people who could benefit from this?
Alex, 30% of our population is chronically ill. Obviously, at the Memphis Heart Clinic, we're focused on cardiac patients. But what we're finding is a lot of people want to proactively manage their health. They want some ownership over their medical records. President Bush has asked that all Americans have a transportable copy of their medical record in 10 years. Fortunately, we preempt that and are able to offer to our patients today. Just to elaborate as well, one of the things that we found is our patients were using the web to get health information. Now, the problem with the web is it's very fragmented and it's not regulated, and a lot of the patients would come into the clinic with information that was inaccurate. So what MyRECORD does, it also actually pulls information that's specific to the patient. For example, if you're on Lipitor, you click on Lipitor and you get the drug profile. What happens if you miss a dose? What happens if you overdose? What it could possibly interact with. Same thing for diabetes. If you're suffering from diabetes, you click on diabetes.
Why don't you show us there on the screen?
Sure.
Is that something?
What we do is we instruct patients to carry MyRECORD with their identification.
And so it wouldn't get scratched. It comes in a
plastic
case.
sleeve.
Okay.
So if you're unconscious, healthcare practitioners are trained to look for your ID, pop it into any computer, and up comes your medical record.
Now, Alan, is any type of password needed by someone to get into it, or how quickly can you access that information?
It's a really good question, Alex, because a lot of people ask that, but the people that carry our card realize the life-saving potential, and they say, well, what happens if I'm unconscious? The disc is useless. So overwhelmingly, people say that they do not want the disc password protected. It's
Is
easy
there
for us
any
to do.
privacy information that might be a problem if it just got out there?
Well, we don't put insurance information on there. Things that, you know, could cause any financial burden to a particular patient. What we're trying to do is focus on that pertinent information that a patient needs in an acute situation.
Okay, strictly medical.
We've had patients that also provide a record to a family member so that if they're not available immediately, the family member can give the information.
Okay.
I'm also wondering, gentlemen, what about the cost of something like this? Or will maybe an insurance company kind of pick up the tab?
At this point, it's a low cost. It's $40 for the initial disc and then $10 per year for an update.
Oh, that's...
And it's not covered by insurance plans currently, but we would hope that with the governor's initiative and the president comments at the most recently, that this will become a widely spread means of transmission of medical data.
Well, and speaking of costs, it seems to me that if you go into a hospital in an emergency situation and you can instantly access all this information, that saves costs in the long run because you don't have to have perhaps a lot of unnecessary tests that you might otherwise have to have. Doctors might have to perform to try to figure out what the heck's wrong with.
You're absolutely right. The cost of duplicate testing and the cost of medical errors, prolonged hospital stays, there's a whole host, and that's really what I think the initiative is from the government, is to really, we need to get some costs out of the system. You know, healthcare premiums are continually on the rise.
And quickly here, gentlemen, in the 30 seconds or less we have, what about updating the information on the disc? How often would I have to do that, or my doctor, or whomever?
About once a year we recommend that. You know, most medical care occurs in the outpatient setting, not in the hospital, so that updates should occur frequently.
All right, very good. Thank you very much. And
Thank
this is the disc, easy to keep in your wallet right with your ID, so in an emergency situation you have got all of your information. The Memphis Heart Clinic, get MyRECORD free just on Thursday, is that correct? January 27th?
We're having an open house at the clinic for our patients too, and we'll be giving away 100 of these records.
Wonderful.
That
so
is great.
be one of the first 100 there, and there on the web is the information you need to access the clinic.
Gentlemen, thank you so much. We
Thank
appreciate
you.
it.
Thank you. I
Very
appreciate it.
interesting.